Good morning, this is Dr. Doreste with the Cranial Release Technique. It's Friday morning, July 5, here in New York City, and yesterday was the 4th of July. I hope everyone had a safe and happy 4th of July yesterday. Most practitioners are off today and probably back to work on Monday, and I wanted to just share a thought, and hopefully you'll get to see this over the weekend and you'll have some time to think about it. So when we take a look at this poster that we call the Crt Choice, it's actually one of my favorite posters, and it's a very easy way to explain the cranial release technique to a patient. But I really want to speak to practitioners right now. And I'd like to put up what I'll call the CRT challenge to you. What I mean by that is that regardless of what type of practitioner you happen to be, chiropractor, acupuncturist, massage therapist, physical therapist, naturopath, even some of the holistic dentists, regardless of what the degrees are behind your name, if you're working with patients and you're putting hands on patients, this really is directed to you. So the patient comes in, you're going to see them on Monday morning, and before you do whatever it is that you do, let's just run a simple little test. If you just lay the patient on their back and check their legs, check the leg length, and some of you know how to do it and maybe some of you don't, but basically lay them on their back like the middle diagram, and for all practical purposes the legs should be relatively even, balanced. If the patient were on their back, let's say, and you check the iliac crest should be virtually balanced. And what you're going to find, in my experience, will be one of the legs will be short, that pelvis will be high, or it could be the other leg that's short, and that pelvis will be high. And of course, in the world of cranial release, we're assuming that it's not a pelvic problem and it's not a leg problem. It's actually a brain hemispheric activity problem. So in the middle diagram, we have balance between left and right hemispheres. That's going to balance the structure. And that patient is in what we call whole brain function. They're healing, repairing, regenerating. Because of stress, in my experience, most of your patients, if not all of them, will be figure number 1 or figure number 3. So now you lay that patient down, and let's assume you find that there's a right short leg. And now you do your chiropractic adjustment, or you do your massage therapy, or you do your acupuncture, or you do your PT, or whatever it is that you're going to do with the patient on that visit. Well, before they leave, just lay them back down. And the question I have for you is, did that leg length come back towards balanced? It doesn't have to be 100%, but did it improve? And in my experience, if you just get the patient to go and walk down the hallway and come back, that's really the best way to do this test. So they'll come in, you'll do your evaluation, you'll make your adjustment, you'll do your acupuncture, you'll do your massage, you'll do whatever it is that you're doing that you always do with those patients. Have them take a walk down the hallway, lay them back on the table before they leave. Hey Mary, I want to check one thing before you go. And in my experience, that probably won't even change from when you began 5 minutes ago, 10 minutes ago, 1 hour ago, whatever. And the reason why it didn't change is, in my opinion, because you didn't change the hemispheric balance, which is what cranial release does all the time. As a matter of fact, virtually after that first visit where I obtain all the information and the history and I do my initial physical check, virtually visit 2 to visit into infinity, they're basically going to lay on the table. I'm going to check their legs. I'm going to see which leg is short. I'm then going to turn the legs in to internally rotate the feet to see which leg is tighter. In my experience, the short leg will always be the tight leg. I'm then going to apply the cranial release technique, and then I'm going to recheck the legs. And in my experience, if the cranial release is done correctly, the leg length will improve and the tension through the internal rotation test will improve. That's how I know that I completed the CRT properly. I applied the technique properly. So again, for those of you that are not doing the cranial release technique, you'll do your massage or your acupuncture or your chiropractic or your physical therapy or your whatever manipulative techniques that you do. But the question is, are you affecting the brain? Are you affecting the central nervous system? And are you changing the structure? So take a look at that. I'll call it the CRT challenge. Because on the other hand, what if all I'm telling you here in all these videos is incorrect? What do I have to back all this up? Well, I have to back all this up. This is one of many little tests we can do, whether it's high tech or a very simple test with you and the patient and just doing a simple check. But this is something that if CRT is done correctly will improve every time, 100%. You'll see improvement. This is what I tell my students every time. So that's how you know as a practitioner that you did this technique properly. So if you're doing a chiropractic adjustment or massage or myofascial release or whatever technique that you're doing, do a simple test like what I just explained and see, did you change anything? And again, get them up off the table, have them walk down the hallway for 20, 30 seconds and put them back and recheck them. That's actually a more accurate way to do this. This is Dr. Doreste with the cranial release technique. Yes, CRT is a 1-minute technique that can balance brain hemispheres, balance the muscles, balance the structure, balance the autonomic nervous system, release fascial restrictions, and shift the patient so that they heal, repair, and regenerate. So when they leave your office, you've enabled their body to function at a higher level. And then the next time we see them again, and they come back in a few days and they return as figure number 1 or figure number 3, why that's changed is their inability to handle stress, which, as we've discussed in many of the videos, be it physical stress, chemical stress, emotional stress, or EMF, electromagnetic frequency stress. So we want to do our best to keep the patient in the middle so that they can go out in whole brain function and be all that they were designed to be. And this is a very simple way how you can see patients on a regular basis for the rest of their life for one reason and one reason only, to optimize function in their body. Even though it takes a minute to do, you're changing everything. And then you still could do an adjustment on top of that. You can do a massage on top of that. You can use acupuncture. You can do your PT. You can do your holistic dentistry. You can do whatever it is that you're doing. This will just take it to a whole new level. Cranialrelease.com is the website. You can learn how to apply the technique on the website by visiting the online training button. If you're a patient, you can find a practitioner at the CRT practitioner list. We have practitioners in the United States. If you don't see a practitioner in your area, feel free to email me. I may have some suggestions for you. Again, cranialrelease.com. This is Dr. Doreste wishing you a wonderful 4th of July weekend to everyone. Thanks so much for watching. Have a fabulous day. Goodbye.